Welcome back to Groundbreakers. We are showcasing the most successful and the most intriguing entrepreneurs in Canada. My next guest has no shortage in the intrigue department for sure. And I can tell you that he's one of the most fascinating people I have spoken to in a long time, and you're going to love to hear from him. Now, he is the mastermind behind NIB3.ca. Okay, now this is the Neurological Institute of Brain, Body, and Being. He specializes in holistic neurology, integrative neurology. He's doing absolutely fascinating things with biofeedback and human physiology, and he's going to tell us all about that right now. Welcome to Groundbreakers, Dr. Shai Aronov, right?
Hi, Aiden. How are you
Dr.
doing?
Shai, that's what people call you, right? Like
Yeah,
Dr.
at least
People say Dr. Oz, but everybody calls you Dr. Shai, right?
Awesome, yes.
It's so much fun, to have you here. I'm a big fan.
Thank you for having me.
My pleasure. Now let's get right into this. It's absolutely fascinating. The field of neurology.
Yep.
And you're now pointing it towards holistic neurology or integrative neurology. So I guess the place to start is tell the audience what is holistic or integrative neurology.
Well, first, it's important to understand that the point of view of the brain in the last decades or two changed 180 degrees, right? We now understand that the brain is able to change itself, is a plastic organ, is the most dynamic organ in the world today, right?
Up until that, we thought credit cards were the only plastic organs.
Yes, so
it's
there is
not the same anymore.
No,
there's advancement.
The coin is a neuroplasticity. Neuro is the nervous system, and plasticity is the ability to change according to experience,
right,
according to stimulation. Before that, if an individual will have a stroke, you will rehabilitate him for 6-5 weeks until he stops improving, and then they'll send him home. Today we understand that you can rehabilitate and stimulate and change and have new process in the brain to form new connections and break old ones just by the right stimulation and the right training for that. So you can rehabilitate actually a stroke patient after 2-3 years if you do it the right way.
So you say you can rehabilitate a stroke patient. Now, looking on your website, you say you can make progress with insomnia, depression, anxiety,
of course,
autism.
Of
now, these are really, really exciting breakthroughs. I mean, this is an exciting time for neuroscience and for holistic neurology.
Yeah,
that's your phrase, right? So let's talk about some of these. Anxiety and depression. That's something that is really common, right?
Yep.
Very common. Society's moving so quickly. And anxiety and depression is very prominent. So tell me then, somebody walks into your clinic with severe anxiety. How do you apply your philosophy or your concept to help them?
So basically the model is divided to few major interventions aspect. First, to understand that the brain of...
Sorry to interrupt you. So what you do, you call an intervention.
So intervention will be a music therapy, aromatherapy, vision therapy, eye movement, brainwaves, self-regulation, what we call today EEG biofeedback, which is neurofeedback, vestibular stimulation, which is balance, and approaching that way from all...
I want to jump in here because you're using a lot of really fancy words that a lot of people at home might not understand. So I wanted to simplify it so everybody, we're all on the same page. So basically you're talking about monitoring through biofeedback,
yes,
right? Pulse, right? So all the biorhythms of the body, brain waves,
yep,
heart rate, all this. And by monitoring this, you now can get a picture of the true human physiology. Is that correct?
Exactly. So it's under the umbrella of applied psychophysiology, which means that we are taking monitorization and measurements of real-time measurements of your heart rate, if it's EMG, your electrical activity of your muscles, if it's how much you sweat, if it's like the temperature of your skin, all those stuff, your respiratory rate, how many times you breathe per minute.
Wow.
We put it on a 40-inch TV and we teach you by conditioning how to regulate that self-regulation, how to lower down your heart rate, how to stabilize the system, how to be more resilient to stress, and to fine-tune that. The other aspect of biofeedback, it's a neurofeedback, which is EEG. It's the same way, but this time we take EEG brainwaves and we put it on the screen in a game aspect, or if it's a movie, and you just learn how to change it by.
Okay, again, so for clarification, you're actually putting somebody's brainwaves right on a flat screen in front of them.
Yeah.
They're watching their own brainwaves in action.
Exactly.
And that way, that would freak me right out. But in watching the brainwaves, you're now teaching them how to regulate their own brainwaves. Is that correct?
It's a different concept based on Pavlov. Pavlov took a dog and
yes, he did. He took him for a walk and he never came back.
Yeah, and realized that every time that if you condition its physiology for every time that you will hear a ding, you'll get food. The physiology gets conditioned into that every time that you have a ding, the dog will begin to salivate, even if there is no food in front of him. So the same way we put a brainwave by EEG sensors on the screen, we set up a threshold, let's say the theta waves. So if
say that slowly.
Let's say theta waves, which is part of the brainwave spectrum.
Yeah.
And if I decide that there is a threshold, and above this threshold, let's say you watch a movie and that movie will stop when the threshold is exceeding, the brain can be conditioned to every time that those theta waves going above some kind of amplitude, the movie will stop. The only thing that you need to know that you want to watch the movie.
So really what you're doing basically is you're altering the Pavlovian response of the brain. Really?
Yes.
In a nutshell, which is a great platform for this concept of neuroplasticity.
Yes.
Everybody's talking about this buzzword now, neuroplasticity. And it throws people off because they it sounds a little bit intimidating, but it's not. Simplify the term neuroplasticity for the audience and for me.
Neuroplasticity is simply the ability of the brain to change itself.
Right.
The brain,
and every brain does have the ability to change itself, correct?
In every age. In any
every
age.
age.
Yes.
Doesn't matter.
If it's like 70 years old, if it's like 4 years old.
And this is very controversial because conventional medicine teaches against this.
That was like 25 years ago.
Right.
Today everybody accept that.
Right.
Everybody accept that the brain can make new cells, can make new connections, can break old ones. That's already an accepted fact.
Right. It's an accepted fact.
Yes.
Okay, so where does conventional medicine measure up to what you're doing?
So conventional medicine doesn't know how to induce that process, right? So they're aware that there is some neuroplasticity happening when you are forming new memories, when you have some experience, when you learn new stuff, but how do you induce that process to direct it to the healing aspect of it, to direct it to the positive aspect of it. Neuroplasticity can be bad sometimes. Neuroplasticity is the major cause of chronic pain. Chronic pain is you learning that some kind of your body, some area of your body sending a signal of pain. When that's not existing anymore, your brain already...
But the brain is so accustomed, right, to going down that neural circuit.
Yes.
That it actually believes there's pain when there really is no pain. Is that correct?
There is already a memory process of that pain.
So you were saying that neuroplasticity is altering the circuits in the...
Could be bad, could be good. Depends how it's used, right?
Right. So they're having great success in this area with autism.
Yes.
Let's talk a little bit about that, because this is a really exciting breakthrough. Tell me, first of all, let the audience know what autism essentially is, if they don't know, and how you can, if not cure it, maybe you can cure it.
Not cure it, I guess.
But how you can minimize the effects.
Minimize the symptoms.
Okay.
So autism, it's nobody really know what is autism today. There is no marker for autism. You can't go to your blood and to find some markers, or you can't even have an image of a brain that's saying, oh, this brain have an autism. Autism is by exclusion. You have the DSM, so you have a questionnaire, how much you mark, what symptoms do you have, and if you exceed some kind of point and you have all the criteria, the child have an autism. But like today it's a little bit different. It can be changed. I mean, like by sensory stimulation, by helping the brain to develop better.
But what is autism essentially? It's a cognitive disorder, correct?
It's not a cognitive disorder. It's a regulatory deficits of the brain.
Between the left and right hemisphere.
Between both hemispheres, yeah.
Right.
Now we're going towards a model that's saying that actually autism, it's a stronger right hemisphere. But it depends, because it's always switch from right to left, from right to left. But the main aspect of it is like the savant syndrome. Most of autistic children are really, really good in some stuff, which is, you know, maybe one hemisphere actions, but it's really, really worse in others, like a social...
Right, but isn't it essentially a hyperactivity in the left side of the brain?
Yes, yes, sorry, I'm correcting myself, yes.
Okay.
Hyperactivity of the left.
I feel good that I was able to correct you.
It's good.
It just makes me, as an interviewer, feel like if I can just, get the guest to contradict themselves once.
Of course.
It just makes me feel like, I'm earning my money.
I'm
earning my money, right?
I'll correct myself with that. So autism is mostly left strong hemisphere, and we see it on autistic children that they have a phenomenal memory. They have phenomenal ability of math and seeing stuff, but that which more left hemisphere. But right hemisphere, social aspect and social and eye contact, all those stuff are missing.
So it's abnormally low.
Yeah.
Is abnormal. And conversely, other disorders involve a hyperactivity with the right side of the brain. Anxiety is certainly one of them.
If it's depression, or if it's OCD symptoms are reside more on the right side of the brain.
Right.
More the negative effects of the emotional point of view of each and every one of that. Like right brain is more negative, left brain is more positive. Right brain is more withdrawal, left brain is more approaching. We go into all the symptoms and we examine from all pathways and stuff, and majorly we address the strong area, the hyperactive area of the brain, and we are coming down those areas and we stimulate the weaker ones.
Amazing. It really is revelatory and revolutionary. It really is. I don't want to put you on the spot here, but you know that I'm going to. I really admire an expert who comes on a show and admits to his own foibles, his own frailties, his own weaknesses. Do you, what am I trying to say here? Do you have OCD?
Nope.
No?
Not yet.
Have you ever suffered from anxiety and depression?
No.
No?
No.
Insomnia?
No, I didn't.
You're a perfect specimen.
No. But like still, I've been experienced those symptoms as a general injury that I suffered in the past.
Right.
So I saw those symptoms going away, and with regards to those interventions and everything, yeah.
Okay. So let's talk about obsessive compulsive disorder for a second. Okay, because again, I look around in society today and I see the numbers are growing. You have to agree on that.
Yes, definitely.
The numbers are growing. Society's moving so quick. Information, superhighway information's overloading us. We're stressed out, and that stress creates anxiety, and anxiety seems to put into motion an obsessive compulsive component, right?
Yes, definitely.
How do you treat somebody who comes into your clinic with obsessive compulsive disorder?
I'm not going to go in too much detail,
but just give me an overview.
The main mechanism is like there is a thought, there is a need, and the person can't really like shift the gear, right? He's stuck on the aspect of like I need to repeatedly doing that. Those mechanisms reside in a place called the basal ganglia, which is in the base of the brain. This place is responsible for eye movement as well.
Oh, interesting.
Basically, every disorder, in each disorder, we are going and we are checking all those aspects and all those functional aspects, what is fault and what is too much, and we stimulate it
What is
appropriately.
you mean what is low and what is high?
Exactly, yes.
By looking at both sides of the brain.
By looking on eye movement, by looking on visual aspect of stuff, hearing, coordination, what's sensation, the sensory input, the motor output, all those stuff, all those aspects, which is standardized neurological exams, but we are looking at by comparing side to side and the function of it.
Right, right. And with all this knowledge that you've acquired in all of these areas, you've become very, very, what's the word? Very, very perspicacious and very acutely aware of other people. So you can probably tell. You can probably tell a lot by looking at somebody, right? Yeah. So what would you say you can tell about me? Just by looking at me for about, now it's been about, what, Rich? About 10 minutes, 15 minutes? So don't hold back on me. I'm going to have you back on the show regardless. Don't worry about it. You're a nice guy. You're clean cut. You're very well mannered, which we like in our guests.
Try to.
You're coming back here regardless. But seriously, what could you ascertain without offering anything offensive?
Yeah.
Because then you won't be back. What can you ascertain, like in terms of eye movement?
Well, a simple observation of head tilt, for example. Head tilt is a compensatory mechanism to a weaker side of eyes. So if your eyes, let's say, is a little bit higher, the head will compensate by tilting to the other side in order to make them horizontal, which the brain is very care.
Which tells you that I am favoring a certain side of the brain.
Yeah, but it doesn't tell anything yet because I need to have the whole picture, but I see that there is something, right? So it shouldn't have like head tilt with the imbalance of the eyes.
Yeah, but I just want to let you know that from broadcasting school, what my professor said was an interviewer who was a head tilter was a man of insatiable curiosity. So seriously, that's what I was told. We have a difference of opinion here.
Well,
my professor and your professor got to get together and discuss this.
I guess we need to argue.
Who was
that.
your professor? Where did you learn?
Well, I graduated in chiropractic school. I studied functional neurology and applied psychophysiology and clinical neuroscience in the States, and graduated from a biology psychology degree
with honors. And you know what? It's your reputation here in Toronto and Canada already is so, it's so well established, and you're looked at as a leader in your field. I'm not sure if you're aware of that. I don't want to embarrass you, but the thing is that a little bit of background on you, which is absolutely fascinating. You come from Israel.
Yes, I do.
All the way from the Middle East, from Israel, this tiny little country in the middle of the Middle East, and a totally different climate. Socially, politically, emotionally, and now you're here in Toronto, and I'm wondering, how you've adopted to this culture shock. That's
that's actually a discussion for.
That's a discussion for Oprah Winfrey, not for my show.
Yeah, well.
But how have you adopted? Because
it's definitely not easy, right?
Yeah.
The weather is a major one. I'm used to 30 degrees stable. Here it's always fluctuating, like 15 degrees up and 15 degrees down.
Right. By the way, during the course of the interview, I noticed that your head was tilted 25 degrees down, which tells me that you're not impervious to Canadian climate yet.
I'm just ashamed, yes.
You're not. You're affected by the elements.
Yes, definitely. Well,
socially, emotionally, how have you? How is it different?
It's different. Well, I don't want
to. How has that affected you launching as an entrepreneur? How has that affected you launching yourself?
I guess people are less open to something new. People used to a specific healthcare system and specific paradigm. But like it's getting there, and people listening, people see different. It makes sense to people that like if one eye is moving slower to the right side, they should have both speed on both eyes. It makes sense to people that like the one side of the body shouldn't sweat more than the other, or
right.
If your hands is cold, they should be cold at the same in the same temperature, in the same sides. So you have to use those examples to simplify the picture. But like in the second that you see it on the screen and you see the imbalance that they might have. Sorry.
And you were saying in the pre-interview that you find that creative people, artists, okay, known for their creativity, tend to be predisposed to anxiety and depression and other, disorders which stem from a dysregulation in the hemispheres of the brain.
I won't say
or an overactivity in the right side.
I won't say dysregulation, but it's a biased, right? Like a biased activity to the right side, which is not bad, right? It make you more creative.
Yeah.
It make you less good in science and math.
It's a blessing and a curse.
Exactly, but like the problem is we all individual, right? Like the problem begin when you suffer an emotional trauma, when you suffer a concussion, which is like an epidemic today, when you have some traumatic injury, then when stuff are coming up and the vulnerable brain is responding by inhibiting the weaker area and excite those hyperactive one, then you begin to experience some panic attacks, anxiety, depression, or whatever it will be.
Okay, so, you're now launching these clinics across Toronto. NIB3.ca for those that want to learn more about Dr. Shai. NIB3.ca. You'll be absolutely fascinated with what he's doing in the world of holistic neurology and integrative neurology. It's amazing. I want to ask you something. I don't mind telling you that I got a little bit of OCD happening. I'm a creative guy. It's in my DNA, and there's things that I do that are habitual, right? Now, a lot of people do things that are habitual,
yes,
to one degree or another. For example, I flush the toilet, and I'm going to embarrass myself here, but I flush the toilet with my foot. Okay?
Yeah.
It's embarrassing to say that on national television. It's embarrassing. But could you fix something like that? Like, why am I doing that?
Well, it's just like an automatic response, right? You used to do that. You started to do that from a specific reason, and you just keep doing it.
Well, do you know why I do it?
Because you
I don't clean at home. I don't trust my cleanliness, and I'm afraid of the germs. But from a Pavlovian perspective, right, it becomes a repetitive thing, right?
The threshold.
Could you cure something like that?
I can't claim to cure anything, but like
What do you claim to do?
I can improve those symptoms. I can diminish them, but in the end of the day, it's not me that's doing it. I can help you doing it, right?
Right.
I call it a training. It's not a treatment, it's training. It's training of self-regulation and self-induced neuroplasticity in the end of the day.
Self-regulation, self-induced neuroplasticity. The building blocks of your practice.
Definitely, yes.
Definitely. Okay, well, listen, it's been an absolute pleasure to have you on the show.
Thank you.
You got to come back here. We got to talk again about all this about all this interesting stuff. And is there anything that that you want people to know, about your practice that we have not mentioned, because we have about 30 seconds left, and I'm not sure if there's something that you're. Where you look right now, you have your primary clinic is at Shepherd and Bathurst.
Yes.
Okay, and all the information is on the website?
Yes, everything is there. We're going to open another clinic now in Yonge and Eglinton area. The best way to put it down, there is another option. There is an alternative to medication.
That's what you want people to know.
Yes, there is an alternative to medication. There is an alternative for suffering. We approaching it from 3 points of view of brain, body, and being. Brain with the self-regulation, body or nutritional aspect, mindfulness training, all those together are addressing the same.
Did you address the last one? Being?
Being, yes. Being is a mindfulness training, compassion focused therapy.
Brain, body, and being.
Yes.
Integrated together?
Yes, definitely.
Into one philosophy, right?
Yep.
All right. I should be your PR manager, right?
You should.
Yeah. I think you'd do pretty good. I think you'd do pretty good. There you have Dr. Shai Aronov.
Yeah.
And from NIB3.ca, the Neurological Institute of Brain, Body, and Being. Absolutely fascinating stuff. I hope you come back again. It's tons of fun to talk to you. We're going to wrap up this edition of Groundbreakers. My name is Eden Wall. We hope to see you back here, same time, same place, next time, as we showcase the most intriguing and the most successful entrepreneurs in Canada. Thanks for being here, everybody. We'll see you next time. Take care.